Hello, my name is Ron Hallman, and I'm the Vice President for Public Relations for Porter Medical Center here in Middlebury, UVM Health Network, Porter Medical Center. And we are here today to talk about a new service that we initiated this summer called Porter ExpressCare. And with me is Tom Beauregard, who is a clinical leader for our ExpressCare service. And we want to introduce this to the community, so thanks for joining me.
Thanks for having me.
All right, we're going to have fun. So let's start at the very beginning. What is ExpressCare?
ExpressCare is Porter Medical Center's brand new service line to introduce same-day appointments for people who need to be seen that day for their urgent care needs.
Okay. So it sounds like an emergency department. How's it different than the emergency department?
Good question. Emergency department should be reserved for people who are having potentially life-threatening conditions. ExpressCare is a step down from that. If you have something like a sore throat, bronchitis, your doctor can't see you and you're sick, or you injure your foot, sprain your ankle, sustain a small laceration, where the bleeding is fairly well controlled,
Sure.
you belong in ExpressCare.
So if you need service right away, but it's not life-threatening, and it's just something that we were just talking before we started shooting this morning about someone who got poisoned parsnip and showed up at your service. That would be a perfect example of
Absolutely.
someone who is not doesn't have a life-threatening, but they want it taken care of right away.
Yeah.
Because it's uncomfortable. So that's essentially what you're all about.
It is. We're there for you when your doctor can't see you.
7 days a week.
7 days a week.
Yep. Good. So where are you located?
We are located in the old conference room area in the hospital.
Okay.
So as you enter into the driveway, you
Yep.
take that first left, and we're all the way over to the side.
Okay. So for people who've lived in the community a long time, it's the old nursing home, right?
Correct.
Now known as the Collins Building. That used to be the conference room area, and now is ExpressCare.
It's undergone several metamorphoses through the
We've
years.
recycled that building well over the last 25 years. So let's talk about why. Why have we opened up this ExpressCare clinic? How does this fit into, sort of from your point of view, Tom, how does it fit into some Porter's strategic goals in terms of access, quality, customer service?
It's all about patient access for us.
Right.
To have a service line where folks can come in and get seen.
Yep.
We have a tremendous amount of people that come from out of state. We have the language school that's here in town.
Yep.
We have Bread Loaf Writers Camp. A lot of people come to vacation in this area.
Yep.
A lot of people come to just visit, even in the fall.
Yep.
And sometimes those people need to be seen. And they don't always need the emergency room,
Right.
but they may need to be seen fairly quickly.
Right.
So, and there's a lot of people who the offices potentially may have quite a few appointments
Yep.
and not be able to see them.
Right.
And they may have a medical need.
Right.
So to increase the patient access throughout the community was huge.
Okay.
And to offer quality care, that was job one.
Right, right. So you have a great team of providers, all that are trained to work in that setting. So in terms of the quality, it's certainly going to be comparable to. A matter of fact, you work in a physician's office in one of our outpatient clinics down in Neshabie.
I do.
So it is a comparable level of service.
Yes.
To primary care.
The Porter ExpressCare is staffed with primarily what they call APPs, nurse practitioners, or physician's assistants, and they are folks who have been around for a while.
Right.
Our primary provider is Sean May, who has quite a bit of experience as a physician assistant. We've done, some of you may even find local primary care providers filling in from time to time.
Okay.
To help us out.
So you have some bench depth in terms
do.
of different types of providers, because you do have to fill a lot of hours during the week.
We have 7 days a week to
7
fill.
days a week.
So.
So then, in terms of the great customer service, which is another strategic goal, 7 days a week, 9 to 7.
Monday through Friday is 9 to 7.
Yep.
Saturday is 9 to 5, and Sunday is 9 to 3.
Okay.
And we chose those hours to align with pharmacy.
Okay.
So that, because we don't stock medications in ExpressCare,
Okay.
we want people to be able to get out, get their prescription if they need it, and get to the pharmacy to fill it.
Got it. And I would imagine, especially on Saturdays and Sundays, when many primary care offices are closed, it's weekend, that would be a time when that customer service part would really be important. If you have someone in your family who requires services on Sunday afternoon, it's probably hard to find an open office, right? So
Yeah.
you guys are there for that.
We find a lot of people delaying treatment through the weekend because they feel they don't need to be in the emergency room,
Right.
but they have something going on.
Right.
Either they have a really bad sore throat, a fever,
Yep.
a urinary tract infection,
Right.
and now they have access.
Yeah. I actually was talking to someone yesterday who lives in out of state for most of the year and spends her summer in Vermont, and she doesn't have a primary care provider, and she was asking me, who I would recommend. So I gave her some names, and she said, or I could just come to ExpressCare, when I'm here for the summer. And I'm like, that's a good idea as well. So people who are part-year residents that also could provide a little bit of extra support.
If they had an acute need, for sure. And we can also help establish them
In
our
our local
network.
practice.
Yes, we
Right,
can.
right. So I think you've answered this question a little bit, but so the kind of person who generally seeks care at ExpressCare, they're just looking to get an acute need met
That is correct.
right away.
Yeah.
In that moment, they don't need emergency care. And again, the next question I think you covered. So when a person should go to the emergency room is when they're really feeling as if their illness or their injury is life-threatening.
Yeah.
Is that
There are
essentially?
several conditions that are
Yep.
really hard to work up or evaluate in ExpressCare.
Okay.
Things like abdominal pain,
Okay.
chest pain,
Yep.
shortness of breath.
Okay.
Those are conditions that can have some rather severe consequences and causes. So they often require lots of blood work, x-rays,
Yep.
sometimes IV fluids. Those are really hard to do in ExpressCare.
Okay.
So if you have what I would call a relatively simple complaint, again, sinus infection, bronchitis, just not feeling well,
Right.
you injure yourself in any way, get a splinter, fish hook,
Right.
those are things that we're there for.
Either. And if someone does inadvertently present to you and you feel as if this is really an emergency situation, you have protocols to get that person downstairs right away, right?
Absolutely. We are in tight communication with the emergency room. There are backup supervising physicians. We will place a phone call and expedite the care down to the emergency room rather quickly.
Because you're only a few hundred yards away.
Not very far at all.
Right. Okay. Good. Shifting to a financial question, does ExpressCare accept all insurances, including Medicare and Medicaid?
We are enrolled with all the payers,
Okay.
including Blue Cross, Cigna, MVP, Medicare, and Medicaid.
Okay. Straightforward. And you did mention that you're open to align with pharmacy so that when folks leave, if they have a medical prescription need, they can go to a local pharmacy and fill it. So that's so. Talk a little bit more about the providers who work at ExpressCare. How many of you are there? And I think you mentioned that there's a combination of types of providers.
Yeah. So we have, again, we found Sean May as somebody who's come back to the area. He was here for a long time, left to do some different stuff and came back, and we got him pretty quickly because he's outstanding. I pull some shifts. As a clinical director, I do anywhere between 10 to 18 hours a week.
Okay.
In addition to some of the administrative functions that have to happen. We have emergency room physicians who might be filling in from time to time.
Okay.
Family practice doctors. Scott Smith is a family practice doctor
Yep,
who was here for a very long time
Right.
and then left to pursue some locum tenens work, but is here sporadically, and we have employed him
Okay.
and got him ready.
So it could be a number of people, but they're all very competent folks. They're all folks who have privileges at the hospital, many of whom have been in this community for a number of years. So, so that's great. So what about so if someone comes in with, they think they sprained their wrist or they're not sure and they need an x-ray, or someone comes in and they need some lab work, how does that work for an ExpressCare patient?
That's a great question. So for an x-ray, we have a policy in place where we page out an x-ray tech and they come and get the patient in the wheelchair, bring them down to the department, take the x-ray, and then bring them back.
Wow.
And because we're digital, we can look at the same images with the emergency room physician at the same time and review them, or the radiologist if they're around.
Okay.
So for the x-rays, we have a really great workaround.
And how about
workflow.
lab tests?
We do point of care testing in the ExpressCare itself, and that's for rapid strep, mononucleosis testing, urinalysis, urine pregnancy test. And if somebody needs the lab test that we don't do, that it needs to be done, sent down to the lab, we can draw the blood and we can send it down.
Okay, cool. And if I do have a local primary care provider who is closed, or I just can't get in that day, will my local provider be aware of the fact that I went to ExpressCare? How will they get information from you?
Yes. For those primary care providers that are employed in the Porter network, we use the same electronic record. So for seamless transition, they will be carbon copied that note electronically.
Okay.
And for folks who do not have a primary care doctor who's employed by Porter, we take the note and we scan it and fax it over, as well as being part of Vital, which is the Vermont Information Exchange. Okay.
So it's, in terms of maintaining that continuity of care, you are integrated into the system so that that person, information goes right to their primary care doctor's office. And
we've really strived to create a service line that's not a standalone sort of entity. It's meant to be cohesive and fully informative and with complete collaboration. For example, with pediatric patients, we see patients 3 months and up. But we also recognize the American Academy of Pediatrics has stated that they don't think their patients or pediatric patients should be seen under the age of 2. So to help with that, we have developed a policy that from ages 3 months to 2 years, we will contact the pediatrician or primary care provider, regardless of the complaint, to ensure complete communication and complete collaboration.
Great. So if a child is not feeling well on a Sunday afternoon and they just don't have any other place to go, you will do what you can appropriately and then communicate with the pediatrician office Monday morning or...
Oh, actually that day.
Oh, that day?
Yeah, we will call the pediatrician on call.
Oh, okay.
Specifically if they're under 2, or if there's any sort of strange complaint that's not straightforward above the age of 2.
So right on the very day?
Right on the very day, we will page and collaborate and create that rather seamless transition of care.
Okay, excellent. So what if I don't have a local provider? What if I've just moved to town and I didn't sign up with a local provider and I come to see you? Can you help me get established with somebody?
We can absolutely help with that. There are numerous physicians in the area taking patients and we can help facilitate that, as well as if you need service care or basically care beyond what we can do. Let's say you break your ankle and you need orthopedic follow-up, or if you have something wrong with your tonsils and you need to see the ear, nose, and throat, we can facilitate that referral for you.
Okay, good. And someone asked me recently, I think it was a local business owner, who has historically sent injuries on the work job, during the workday. He has an employee who cuts himself or whatever, and his only option so far has been to send this person to the emergency department because it's the only option. It's not life-threatening, but it needs to be taken care of. So in terms of that type of thing and workers' comp type situations, are you guys set up to handle that kind of injury, workplace type situation?
Sure. People who come in with workplace injuries for the initial evaluation, we can totally handle that. We are not currently doing follow-ups on workman comp issues at this time. However, that's an evolving conversation. As well as the DOT examinations for people with
and that's a big,
CDL.
There's a lot of those, right? That's a lot of opportunity there. So
our hope is to expand that line.
Good. And part of my job is fundraising, and I know that the college, the Lions Club, the auxiliary, and some anonymous local individual donors really helped to make this possible, right? I mean, I think
it was huge.
We were pretty happy with the support from our community in terms of, I think we raised $160,000, $170,000 for this project. So it obviously it resonates with people.
I think the community at large knew that we needed this for a long time, and people rallied. Auxiliary, Middlebury College, and the Lions Club, and other various, like you mentioned, anonymous donors. And the response from the community has been overwhelming. Yeah,
it has.
Very happy with the service.
Good. So you've been open for several weeks now. So what is your general characterization? Is it going exactly as you envisioned? Have you had some surprises? what are some of your takeaways after the first couple of months?
We're a little busier than what I expected.
Okay.
So, and that's a good thing.
Right.
It's hard to forecast what this model was going to look like
Sure.
as far as like for usage, but we've had some very busy days, and that just goes to show that the need is definitely there.
Are there any patient groups that you're sort of surprised that you're getting a lot more college students or a lot more elderly people, or is it just a little of everything?
It is definitely a little bit of everything,
Right.
and I'm not at all shocked about the number of folks from the college or the language school who have
Right.
utilized our service line because they don't really have anybody.
Right.
So they should be utilizing
Okay.
us. I have been a little surprised with the number of folks who present with certain conditions that we've had to transport down to the emergency room,
Okay.
but that is part of this learning curve,
Right.
and totally expected, I think.
Okay.
But still.
And last question I have is there anything else you want to share about ExpressCare? Anything that I didn't ask about? Any important tidbits of information that you want people to know about? Or
I got to tell you that the team that helped get this off the ground was second to none.
Yep.
Between Dr. Amanda Young, who's the emergency room physician,
Yep.
was integral in just getting this going.
Right.
Liza Eddy has been the operations manager, and she was wonderful.
Yep.
And then all the other people that were involved, Dave Ford
Right.
from Human Resources,
Right.
Karen Beinauer, chief nursing officer. It was, and Tom Mannion, our vice president.
Yeah.
It was great.
It was a team effort.
It really was.
So, Porter ExpressCare, located on the campus of Porter, open 7 days a week, and come as we say, get in, get well, and go home. So
Yes.
we're happy to have you here. Happy that the service is now available, and thanks for taking some time. I know you've got to get right over and get to work this morning, and
I'm on shift today.
you're on shift today. All right, thank you, Tom. And
Thank you.
Have a great rest of your day, and
Thank you.
thank you for joining us for this educational program from Porter and about our ExpressCare service. If you have any questions, check out our website, portermedical.org, or give us a call. Have a good day. Thank you.